civil society on top malaria control, immunization, and even nutrition, where they call ACOMIN. They don't call on individuals within and outside the state, but they sharply maintain healthy and cautious lifestyle during the Yuletide season. ACOMIN, however, can't even call on all stakeholders made a step up or even take decisive action. On top, say they go prioritize healthcare infrastructure for their budgets, as according to them, if comprehensive policies they implemented, maintenance of healthcare infrastructure and timely replacement of outdated equipment, it could they easily achieved.
Addressing infrastructure deterioration in our healthcare facilities. Good health is one of the foundations of any thriving society. However, across the country, facilities that help deliver effective healthcare are in various states of disrepair. Through this medium, we wish to mobilize government agencies, private sector, the mass media, and communities to increase investments in upgrading and maintenance of much needed facilities. During the ongoing implementation of the community-led monitoring project, it was observed that many health facilities are housed in aging buildings that have significantly deteriorated over time. These structures often exhibit visible cracks and leaks. Roofs are on the verge of collapse, raising serious safety concerns for both patients and healthcare workers. The compromised states of these buildings not only undermine the quality of healthcare services, but also deter community members from seeking care. There are also significant issues with the lack of functional medical devices in some primary healthcare centers. These include essential diagnostic tools such as weighing scales, sphygmomanometers, and thermometers. Without these functioning devices, healthcare workers are unable to perform basic procedures, which then result in delays and misdiagnosis. When primary healthcare centers consistently fail to meet patients' needs due to a lack of medical equipment, communities lose trust in the healthcare system. As a consequence, patients travel to better equipped facilities or private clinics to access necessary diagnostic and treatment services. Power outages significantly strain healthcare delivery, particularly impacting services during night time. The lack of generators or alternative power supplies plunges the facilities into darkness, interrupting critical medical procedures, delaying diagnosis, and risking patient lives. When power is lost, laboratory tests are delayed, and even basic lighting in treatment rooms may be unavailable. The ongoing lack of water supply in some facilities is a persistent issue. Insufficient access to clean water raises the risk of infections, hinders patient recovery, and compromises overall public health. Additionally, this situation increases the burden on healthcare staff, who must search for water sources, ultimately reducing their morale and efficiency. In bid to contribute to the resolution of these challenges and problems, the ATM, which is the State Tuberculosis and Malaria Network, comprising of the Civil Society and Malaria Control, Immunization and Nutrition, ACOMIN, Network of People Living with HIV and AIDS in Nigeria, Network, and Tuberculosis Network, TB Network, have been re-engaged by the National Agency for the Control of HIV/AIDS, NACA, to serve as Technical Service Organization, TSOs, on the Grand Circle 7, GC7. These CSOs are responsible for implementing the community component of the COVID-19 Emergency Preparedness Grant. The Global Fund approved COVID-19 Emergency Preparedness C19EP grant is being implemented in 21 selected states across the country and will run from 2024 to 2025. The C19EP grant will continue to address issues and gaps in the health systems and infrastructures through strategic interventions to ensure their efficient and effective outcomes are achieved. The C19EP will also integrate the response of health systems community systems, and CSOs to any emerging epidemics in Delta states. Community-led monitoring initiative being implemented by ATM Network has yielded the following success stories. For our Q3, we have the ATM State Advocacy Team response to the stockout of HIV test kits in some PHCs. The issue of stockout of HIV test kits at some PHCs, which are Okwe, Model, Akwebulu, Ugoroke, and Ekurede Ugogo, was reported to the State Advocacy Team. This was discussed with Mrs. Sifo Grace of Saka during the sad visit to her. She placed a call to the local government action managers of the affected LGAs to ensure even distribution of test kits and avert the stockout of the commodity. This intervention addressed the issue of HIV test kit stockouts in the PACs. We have another one. ACOMIN, through their intervention, solves the issue of blocked sockaway at a PAC, Uju local government area, Delta State.
At ATM Network, we started another phase of collaboration with HIV testing and TB screening. We started about 2 months ago. And it will interest you to know that from October, November, December, we've been able to get up to 24 confirmed TB cases. Confirmed. But it's so alarming that there are no drugs for them. So there are no drugs. It's only few of them that are on treatment presently. Yes. So what I want us to do is let us always educate them on how to live. When you get to the communities, teach them on how to live in an air open environment. Some of us in some houses we have just a window. When the air is there, it circulates. For those of us that traveled all the way from Warri down, please, I will advise you to enter a bus that does not have AC. Don't think you are enjoying when you enter the AC bus where everywhere is closed. If somebody that has TB is in that bus, when the person coughs or sneezes, everybody in that bus is at risk because the air remains in the bus. It doesn't have a way of escaping. Please, let's take care of our health, take care of the people around us. For the media, please help us love what we do. And as we deliberate, this is an opportunity for us to probe them, enter them, ask them questions, and get response from them. As we continue, I know that God will help us.
Person will be State Programmes Officer ACOMIN Juliet Obiajulu Income scored their performance for the year at 99.9%. As in comment, the CBOs say they make ACOMIN achieve the deliverables, despite say the late communities implementation, as they expect them to be even more committed and passion-driven for the coming year.